Now, many of us, including myself, have tweaked our backs or had a crink in our necks. And then we know what it feels like to have a limited ability to do the day-to-day things. But for those suffering that type of pain on a recurring, chronic basis, it can seem like there's just no light at the end of the tunnel. Dr. Miller from Total Health Chiropractic may be able to help with a non-invasive, non-surgical treatment. Take a look. Here we are once again at Total Health Chiropractic talking about neck and back pain, chronic neck and back pain. Dr. Miller, thanks for joining us again.
Welcome to our office, Todd. A lot of the patients that are suffering with chronic neck or back pain, a lot of us can't relate to that because we'll have an ache or pain and within a few days it goes away on its own and you're back to doing these things. But these patients struggling, it could be months or years or even decades where it's affecting their ability to live the life that they want. It can lead to things like depression, anxiety, sort of almost like a resistance to even seeing other doctors or, investigating other options because they've been let down so many times. And, they try these things over and over again. A lot of times they're recommended a variety of drugs, physical therapy. That doesn't work. They'll start going to injections at pain clinics and ultimately leads to neck or back surgery. And the issue that we mentioned before is that these treatments generally mask the symptoms. They're not really correcting the cause. And that's why the symptoms persist and the condition persists, and they have to keep doing those treatments over and over again. But it's again, very frustrating, and a lot of them almost just give up hope on life and don't even want to, search for another solution. And that's a tough way to live. Yeah,
nobody wants to be put in that situation, that defeatist attitude of why bother. And a lot of times it comes down to just knowing what the cause is. We hear this time and time again from your patients saying, I finally know exactly what the issue is. And you've got some models here that kind of show what you've been able to show your patients.
Yeah, and we do physical examinations. We'll take images or x-rays, or if they've had that done, we'll get them shipped over to our office so we can review them with them. But I spend quite a bit of time with patients, showing them what the problem is with those images. I'll use these models to sort of explain the process of spinal decay or degeneration, because it is a process that will happen over a lifetime with neglect, neglecting the health of the spine. When they're actually able to visualize this with their own eyes and see what's happening within their bodies and why they've been struggling, it's upsetting for a lot of them to know it's that bad, but at the same time, there's validation why they're hurting so bad, and hopefully we can start talking about solutions and ways to get that fixed.
And you said that it's something that happens over time, but this degenerative disc disease isn't necessarily an old person's game. I mean, this can happen to anyone, right?
It can, and unfortunately, we've seen patients that are even like 17 or 18 years old that have neglected the health of their spine, they've abused it, and this process had occurred very rapidly. And then there's other people that, later in their life, over years, it just gets bad. But it's due to stress in our lives, and that's physical, chemical, and emotional stress and neglect of the spine. It's not old age. And a comment I often make is if it's just old age, every level of the spine would be equally as bad, but that's usually not the case. It's specific levels that are the big problem, and that's where most of their stress is developed.
And the good news is what you do here, it doesn't involve surgery, it doesn't involve injections, it's all natural. Talk a little bit about the DRX 9000, Steve.
So DRX therapy is a medical treatment to regenerate the spine and these injured discs. So if people have things like a degenerated disc where these discs are dried and thinned, it can actually draw moisture and nutrients back into those discs where they can start to rehydrate and thicken up. Sometimes we'll have patients that have bulging or herniated discs like this pushing in the nerves. And like the degenerated disc, with that herniated disc, it can draw and retract that back in so it can be where it should be off of the nerve. And it provides a lot of pain relief. People get mobility back. They're able to work and be a productive member of society again. Many of them are able to get off the drugs and stop doing the shots and say no to the surgery because we're able to provide an actual solution and fix the problem.
Yeah, the solution instead of masking the problem. Monica here is someone that you've recently treated. We're going to get her story next. Tell us a little bit about what brought you here.
Well, I started having problems sleeping. My arms would go numb from my elbows down to my fingertips, so I kept waking up during the night. It got so bad I would just get up for like an hour or two at a time. So my days were shot because I was constantly tired. I first went to my own doctor, and I was told it was just a phase. So I went back and tried to deal with it, but at that point, I couldn't work out anymore. I couldn't, I couldn't work. So I actually saw Dr. Miller on the show, I believe, and just gave him a call that day and got in here that day. And
that's amazing.
Yeah.
Called and got in the same day. That's good. That's
Yes.
good for anyone watching this.
Yes.
To say, hey, listen, you might be able to get help quicker than you think. So when you came in here, what was the process? What was different here than what you had seen from going through a phase doc?
yeah, well, first of all, it was taken seriously. Took the x-rays and talked through, what I was feeling. And I was just so glad to know what it was. I thought my my circulation was messed up. I had no idea it had anything to do with my neck. I was just surprised to see that I had degeneration in my neck. And I think we even started the first session that day because they knew I wanted to get right at it and try to get results. And so we started, and after the first session, I even felt some relief. So
Let's talk about that session. What was recommended? Was it the DRX 9000?
Yes.
All right, talk about that process. What was that like?
it was very relaxing. It felt good to me. Yeah, I got my neck was heated and then cooled off afterwards. So it was a whole process that was very relaxing, and yeah.
Okay. And how many of these have we done, and how long have we been doing this?
I think I did those for about a month straight, or maybe a little bit over a month.
Right.
And then I followed up with a rehab portion after that, which a couple times a week I went onto the Spine Force machine to strengthen the muscles around the spine.
Excellent. So for someone watching this and they're like, okay, it sounds relaxing, you get heated and cooled, you lay down, correct?
Yep.
It stretches you out.
Yep.
And then this Spine Force machine, how long are you here for when you come in for a treatment?
Oh, it's pretty quick. I'm in and out in like 35 minutes.
Convenient then.
Yeah, very
Yeah, in and out. And so how many treatments have you had, and well, what do you feel like today?
Well, I just finished that session, and I think that was maybe 15 treatments.
Okay.
And so now I'm done for now. We'll probably talk about maintenance for the future, but I feel great. I'm sleeping through the night. I've started working back out again and things like that.
Well, after hearing Monica's story and the great results that she's seeing, I'm sure the others watching this are going to want to maybe give it a shot themselves. Got a special?
We do, Todd. We really encourage our viewers to not give up. Call our office if you're looking for a solution. And we have a special for $39. We would do a consultation and that physical examination to get to the root of their problem and really get a diagnosis as far as what's causing their condition. But then as a special offer for the first 3 callers, we're going to throw in a free hydrotherapy massage so that they can just relax and rejuvenate and start to feel better right away. But I just don't want them to give up. Keep searching for an answer, and we're here to help if they want to give us a call.
Great advice. Don't give up. If you think you've tried everything, well, you probably haven't been here yet, because, well, if you were here, you might have seen some pretty amazing results. Total Health Chiropractic. And don't forget that $39 consultation and examination. The first 3 callers get that free hydro massage as well at Total Health Chiropractic.